My name is Vera Sansone. I'm the CEO at CPC Behavioral Healthcare, which is located in Monmouth County, New Jersey. For those of you who don't know too much about behavioral healthcare, we are a community mental health center, meaning that we work with we're a safety net for the most vulnerable folks in the community. And we do mental health for kids and adults, substance use for teens and adults, and we also run a special ed school for kids who need additional services that they can't get in traditional settings. So we have a lot of staff and a lot of needs, and staffing for us has always been a challenge. Certainly COVID has made it worse, but it has been a challenge hiring qualified professional staff. That being said, at the same time that COVID now has, by many predictions, increased the need for mental health and substance use services, possibly by 30 to 35% in the next year, we can't find staff that we used to be able to find really quickly. Case managers, who are people who could help with housing, job searches and stuff like that for our clients. Support staff who help out in terms of everything from billing to front desk kinds of stuff, teachers, assistants, and these were positions that we would get a lot of resumes for because a lot of them are beginning kinds of positions. We can't understand why this is happening, and we thank you for the opportunity to be able to mention this here, but in what we've been looking at, we do think that childcare has been an exceptionally large part of this. So many moms who are teachers or who are in these other positions are consistently having to either quarantine because the kid's been exposed at school, or if they have younger kids, we were told earlier, they're on waiting lists possibly to get their kids into childcare. And so for now, they're staying out of positions because they want to be able to do a good job, and they can't when childcare is such an important issue that's impacting their ability to do that. Another issue for us is that we are highly regulated and audited by virtually everyone, and that has an impact on our ability to hire certain types of staff. If some of the regulations could be either reduced, or if in the case of things like licensing, the response could be quicker, that would also help, because there are folks getting their social work degree who then have to wait a long time to be able to get their license, and they can't really apply for jobs until they're able to do that. The other thing that's impacting us is the sustainability of behavioral health in a lot of settings. We're not sure what the funding is going to look like. We're not sure what payments are going to look like. Telehealth has been a wonderful thing and has really helped us in a lot of ways, but it's also created uncertainty about what happens when the emergency is over. Are we going to be able to continue doing the things that we're doing? Are we going to be able to pay folks the way that we're able to pay now? And so people are either staying in their current positions because they don't want to take that chance, or they're going out on their own and starting private practices where they don't have the kind of overhead that a safety agency like ours has to have. So those are the challenges that we're faced with now, and I appreciate the opportunity to mention them.